Namaste, everyone. I welcome you all to the session. The title of today's talk is Healthy Smiles, Healthy Children, Empowering Families for Lifelong Oral Health. Our guest speaker today is Dr. Nikhil Grover, who is a highly experienced pediatric dentist with 20 years of practice, specializing exclusively in the oral health care needs of children. He holds a bachelor's degree in dental surgery and a master's degree in pediatric and preventive dentistry from GSS Dental College, Mysore. Since 2005, Dr. Grover has been dedicated to pediatric dentistry, managing a wide range of oral health issues in children. In addition to his clinical practice, he has worked as a professor and HOD at a dental college until 2018. His academic career includes numerous national and international publications and paper presentations, highlighting his commitment to advancing knowledge in the field. Nikhil sir, welcome. We are so glad to have you with us on the YES platform. Thank you so much for joining today. Look forward to your session, sir. Over to you.
Thank you so much. Thank you so much for having me. I'll just share my screen, yeah? A very good evening to all of you. Thank you so much for joining us all on this cold winter evening in Delhi, in Delhi ki Sardi as we call it. So my topic for today is Healthy Smiles, Healthy Children, Empowering Families for Lifelong Oral Health. At the outset, I would like to thank YES, which is Yoga Education Spirituality, which is inspired by Sri Aurobindo and the mother with their lessons and teachings. I would like to congratulate them on this amazing endeavor that they're on in helping enriching people's lives and to give me this opportunity. I would like to thank Dr. Ramesh Bijlani and the brainchild of this particular organization, and Dr. Talwar, who also gave me this opportunity, and Arunima, who's been such a great help. So starting with my topic, before I get further into the nitty-gritties of dentistry, I'm sure you all are probably really scared of dentists. So as a pediatric dentist, we have a little different way of doing things. So I just want to get a little glimpse into what a day for me is like and how it's different from general dentistry. So a glimpse into a typical day at the pediatric dentist, at least that's how I practice. Some magic tricks to some balloons, some tattoos. So we do that all to make the kids comfortable. That's how, just a little glimpse into what it's like. So oral health in children encompasses a lot of other issues, but I'll be touching mainly on the topic of dental caries today, because even though we have a lot of we are more holistic today with our treatment towards children, including airway, breathing, and many other issues. I'll stick to the most common, the reason that we get, parents can actually look after their kids with dental caries. So to start off with, I don't know how many of you know this, but which is the most common chronic disease in children? I don't know how many of you will probably be aware of this. You probably think it's asthma, which you see in kids all the time. But you'll be shocked to know it's actually tooth decay. It's totally shocking, So also known as cavities or caries, the condition is about 5 times more common than asthma and 7 times more common than even hay fever in children. Although tooth decay is preventable, which we'll be talking about as we go on in this session, it affects nearly 46% of the children in the US, and the statistics for India are not any better. The US Department of Health and Human Services reports that over 51 million school hours are missed each year due to dental problems. So that's the gravity of the problem that we're dealing with, to a largely preventable disease. This is the kind of patients I get. I know it's unsightly. I'm sure you don't want to be seeing this on a weekend, but these are the kind of kids I get to see every day in my practice, with teeth completely annihilated and destroyed. About 4 in 10 children in India are affected by cavities, and this is just a little infographic to tell you how the impact of dental caries has, what it has on children. So what is this dental caries, as we call it? This is a little of jargon, but I'll just tell it out to you, and then I'll try to simplify it for you. Dental caries or cavities are defined as a localized destruction of both enamel caused by the metabolic activities of bacteria. This condition is the result of complex interplay between diet, host, susceptibility, and the presence of cariogenic microorganisms. I won't go into the details. I won't bore you with all the jargon. Let me try and simplify this for you in simple terms what dental caries really is. So what is it? Also known as tooth decay, it is one of the most common non-communicable diseases worldwide. Free sugars, as you know, we say sugar as the culprit, are essential dietary factors for its development. And dental caries develops when bacteria in the mouth metabolize sugar to produce acid that then demineralizes the hard tissue of the teeth. In simple terms, we call this a key triad or an interplay of three factors: the host, which is the teeth, basically, the bacteria, which we know now as Streptococcus mutans, and substrate or sugar, as we call it. This still sounds very complicated for all of you, I'm sure. So I'm going to try and simplify it further in simple layman terms. Dental caries is a lifestyle disease like all the others that we have: hypertension, diabetes, most of them can be controlled. So in simple words, the bacteria or the plaque that we have in our mouth, the bacteria that's in our mouth, plus the sugar, which is candies or any other sugar that I'll be talking about later, they basically produce an acid. When these two react, they produce an acid. This acid then combines with the tooth, which is basically calcium, and dissolves the calcium of the tooth. In simple terms, the acid eats up the calcium away, and that is what we call a decay or a cavity. In simple terms. So basically, the mouth bacteria plus the sugar leads to acid, which then dissolves the tooth and creates a cavity. So to stop this whole process, we have the place we can act on is either we stop the bacteria, which is by brushing, or we stop taking sweets or have a healthier diet, which I'll be talking about later. And the third way is to strengthen the teeth, which is through toothbrushing or fluoride, and ways that we can do as dentists. So I'll be getting into that later. So that's going to be the crux of my entire presentation: how to stop this at these three levels: the bacteria, the sugar, and the acid. All of you will probably be wondering, these are children's teeth. What does this guy even do? He's a pediatric dentist. Kids' teeth fall out. How does it matter? So this is the question I get all the time whenever I'm, practicing. So it's a big myth that baby teeth are just going to fall out anyways, and they don't really matter. The truth is that baby teeth matter just as much as adult teeth, and are indicators of what the adult teeth will look like. So there's almost 100% correlation between cavities in children's teeth and that of the adult teeth. So don't think that if you have a cavity in children's teeth, they'll fall out, you'll be okay. So that's going to create problems in your adult teeth later. And also, good habits start early, which I'm sure this platform, is a big proponent of. So the earlier you get good habits, the longer they're going to last a lifetime. Bad habits, once they start breaking them, is harder to do. So this is a child. I know it's an unsightly picture, but can you even imagine the age of this child? This child is just 2.5 years old, and this child already has abscess in the mouth, probably taken antibiotics a multiple number of times. And this is the kind of cases we get to see all the time. That's the impact this disease has today on young children. It's heartbreaking as a pediatric dentist to see this. We don't want to reach this stage. So this condition is called early childhood caries, which is essentially tooth decay in children less than 6 years of age. It's, as I said, 5 times more common than even asthma, and leads to pain, infection, and poor quality of life. So this is called early childhood caries in children. This is just a video trying to tell you a little bit about it. I'd made this for an awareness campaign. So
in the decay process, plaque bacteria convert sugar into acid, which then dissolves the surface of the teeth. It is usually seen as white spots around the margins of the gums. In young children, it is usually referred to as early childhood caries seen in children 0 to 5 years of age. The most common cause is bottle feeding at night, or bottle propping, or giving breastfeeding ad libitum. Do visit your pediatric dentist for more details. See you.
So now that we've established this as a problem, we call it baby bottle tooth decay, which is the first signs that we get in children, really young kids, which are, when they just start breastfeeding or bottle feeding. So the prolonged use of the bottle contributes to this kind of decay called baby bottle tooth decay, which I see a lot of as a pediatric dentist. Milk or juice at the bedtime also increases this risk. as sugar pools around the teeth and then leads to these cavities. So the root cause is the amount of time you spend with the bottle. I'll just try to clarify that further. This is essentially what's happening when you take a milk bottle. The milk pools around the teeth when the child is sleeping, the saliva is less. And leads to these unsightly cavities called as baby bottle tooth decay, which is the most common form of cavities in younger children, 3 years plus. But once it starts, then it carries on, till the entire childhood. So what should parents do to avoid this is avoid milk, juice or formula before bed. Use water if you can, and clean the gums and teeth after feeding if that's possible. So we call it feeding at sleep time. So even in the daytime they're sleeping, it's still important to make sure they don't take a bottle in the mouth, or if they have to breastfeed, do it half an hour before. It's a big challenge. I face this almost day in, day out with parents saying, it's very difficult to get them to leave the bottle. So I have a little idea and some protocol for them. You can actually gradually reduce the bottle use, which I'll be telling you later, or offer comfort objects like a blanket or a toy for them to replace this need for a bottle, or breast milk. And you can transition them to water through positive reinforcement. How we do this is I have some two protocols, so I'll be trying to get into that. So the first way is that you basically over a week add some, if the child is having milk at night, you add about 1/3 water, or and then rest milk. Then on the third day, you can make it half water, half milk. On the fifth day, you can probably make it 3/4 water and just 1/4 milk. And by the seventh day, you can start with only water. So the kids are not really having this because of any nutritional value of the milk. It's probably just because they're thirsty, or it's just satiating their serotonin reflex that kind of gives them some kind of calmness. So this is a great way to stop. But even if you find this difficult, because leaving the bottle completely would be the ideal way. But if nothing, you can at least wean them off the milk, which is actually leading to this rot or decay in their teeth. The other option is a tough approach for parents, because they'll have to stay sleepless for a couple of nights. But after 3-4 days, usually kids stop. So you just break the bottle completely, stop, go cold turkey, and stop the bottle immediately, which will probably be a little difficult for the first 4-5 days, but then they'll get used to it, because there's really no benefit of this bottle per se. So these are the kind of two protocols for baby bottle tooth decay, as I just told you. So now the problem is that why do we want to get them to this stage? The problem that we face as pediatric dentists, unfortunately, pediatricians are trying to work this out, but it's not, it's a work in progress. The myth is that, most parents come to us that you don't need to take my child to dentist at least till they're 3-4 years of age, right? Why go so early? Only when they have a problem will come. Dard hogi tab jayenge. That's the attitude. But that's a big myth. The fact is, to prevent dental problems, your child should see a pediatric dentist and establish something called a dental home, which I'll be talking about, when the first tooth appears in the mouth. So we call it the age 1 dental visit, or the first tooth, the first visit. So that's one way that, if you come to us early, we can help you to not reach all those stuff that I showed you earlier, and, tell you not to take a bottle when your tooth comes in, because the teeth come in around 1 year of age on average. 7 months is what they call it. But in India, it's about a year when your first teeth of a child come in. So, we want them to come in before, so we can tell the parents, stop the bottle, or if you're having a bottle, start weaning, some ideas, some tips, and we can work together with them. So the age 1 visit is critical. It's all over America, everywhere. This is by the American Academy of Paediatric Dentistry, which recommends that the child's first visit be no later than the age of 1, but preferably when the first tooth erupts. By visiting a dentist at this time, we create a dental home, and we can give anticipatory guidance. As in, I can anticipate the problems that child is going to have, so they can have a healthier and a happy smile later. So age 1 tooth visit. That's the first thing that I would like to, stress on to start. Get them in early. For pediatricians, please refer, send it across so that we can start young. Here, what basically parents can do at home also is something called a lift the lip exam to see for early signs of decay. And that's what we do at the age 1 visit, or when they come in early. I'll just show you this is a typical video of that. Oh, sorry.
Screening a child for tooth decay usually just involves lifting their top lip and seeing the outer surfaces of the front teeth for signs of decay, which will be shown later. During the lift the lip examination, sometimes we get to see white chalky spots or lines near the gum line. Sometimes yellow or brown pitting may be present, and in more advanced cases, straight out decay is seen. In cases of For advanced caries, do visit your pediatric dentist or general dentist as soon as possible to get timely attention for your child. See you.
So visit your dentist, as I said, start them age 1 dental visit. So we establish something called a dental home, which is to get your pediatric dentist, establish a relationship with a dentist or a pediatric dentist, where we focus on prevention, education, and regular checkups, and build a lifetime of trust and healthy habits. Coming to, we talked about the bottle, we talked about all of this. So the dietary factors that contribute to caries, what I'll be talking about next. Okay. So we have the bad guys and the good guys. So the good things in simply put are cheese, yogurt, fruits, vegetables are a good thing for the teeth. And the bad guys are the sugary drinks, sticky candies, chips. All of this is not good in general health as well as for the teeth, of course. So the good guys, bad guys is a little infographic, So fruits, vegetables, dairy products, fluoride, these are good. The bad guys are sticky sweets, starchy snacks, soda, all of that. Just to tell you further, elaborate on this dietary factors, because this is something that the parents can control at home now. Obviously, balanced diet plays a role like in every other way. So we have a balanced diet with calcium and vitamin D playing a good role. You can start, supplements when they're young to help them out and have a diet rich in vitamin D and calcium. So I don't know if you're aware of this, but you can just go on this website and see the My Government, the plate. So this just tells you what a balanced diet for a child should be like, with fruits, grains, vegetables in this proportion in a plate. So, this, I won't go into the details, but this is like a reference of a balanced diet is equally important for health as well as for the teeth. It works both ways. Coming to what our big culprit is, which is basically sugar. So, why shouldn't you give sugars to nowadays the current guideline says don't give any sugars to a 2-year-old child. Yes, in 2 years, no sugar at all. It helps, it fills their tummy. And of course, too much sugar increases risk of cavity, as we talked. Sugar intake is linked to conditions like heart disease. Too much sugar can reinfluence your child to prefer only sweet things. And sugar is linked to increased risk of overweight and obesity, which we have a big problem that we are seeing. And eating foods with too much sugar at an early age can lead to a pattern for less healthy food later in life. So 2 years younger, no sugar at all. The current guideline also says that 2 to 3 years of age, only 3 teaspoons of sugar. Just to give you a reference, I'll show you another slide later. 4 to 6 years, only 4 teaspoons of sugar. And 7 to 9 years, about 5 teaspoons of sugar. So that's all that's actually allowed currently as per the guidelines go when it comes to sugar intake. So it helps with the teeth as well as general well-being. Just to give you a reference, a Coca-Cola can has about 9 teaspoons of sugar. Just one Coca-Cola can, and even the juices have a lot of sugar, about 3.5 teaspoons. So that's just giving you a ballpark figure of how much sugar is hidden in all these kind of things we take. So sugar consumption definitely linked to caries. Reduce them for your kid. Let them have a healthy life ahead. Another topic that I very, very interesting in today's day and age, which is funnily linked to dental caries, you'll be surprised as to how. So kids are all on the screen nowadays all the time. Some of it is unavoidable. But what happens when they're on the screen is it leads to frequent snacking, which again leads to much more sugar intake than they should. They have poor oral hygiene routines because they're in front of the TV. They don't want to brush at night. All of that. Getting them away from the screen is hard. So limit your screen time to 1 to 2 hours a day if you're older, and less than 2-year kids, again, no screen time at all. Preferably, as I'll talk later, we have much better options, especially what you guys are doing. Yoga and spirituality could play a role earlier on in life even. So what we get to see with this screen time usage is something called food pouching. So what kids are tending to do now is, since they're in front of the screen and they're not using their brains, they're just keeping the food in one corner of the mouth for a long time and watching TV. So that leads to increased decay risk, prolonged sugar exposure in one corner that I'm seeing a lot of this of late. Just cavities on this side of the mouth because of constant, food being stuck there. We call it pouching. And we need to encourage them to chew. So when you come in early, we can tell you all of these issues and, we can rectify it early. Coming to some tips for, to empower the parents towards, a healthy, happy smiles. After all, a smile is a curve that sets everything straight. So, if you have a healthy smile, it really goes a long way. So the cornerstone is, of course, fluoride toothpaste. That is the one most established fact and the way to prevent cavities. In younger children also, and older children also, that's the only thing that works. So how does fluoride really work? It remineralizes your tooth enamel. It reverses early tooth decay. It slows down the process of demineralization and prevents the growth of cavity-causing bacteria. That's just a little brief summary of what fluoride does. So how do you brush now? It's a video by the American. When should you start brushing your teeth? That's a question I get all the time. When is it too early? So this is a video. The next one, we actually have something called training toothbrushes. And this little fellow on the left is actually my nephew, who's now 6. This is when he was a kid. So this is a training toothbrush. So they get used to, the brushing that young, which doesn't have no teeth, but the feeling of brushing and a routine gets established as young as maybe 6 months or even earlier. So it has a guard, if you see, that helps them. They're called training toothbrushes. So you can start that early. It's never too early.
Brush your teeth back and forth, straight across. Don't forget to use that floss. Up and down and all around. When you brush, you hear this sound.
So here you can see the parents. There are 2 parents involved. They're keeping them on a knee to knee and starting, because it's sometimes a real battle to brush small children's teeth. So this really helps, both the parents involved, keep them and brush from behind. I can't cover all of that, but I'll give you my email ID later. You can always call me later or to contact me directly, and I can guide you with this. This is what we do in anticipatory guidance. You come in, I have some videos ready. I get them to the parents, to start brushing, how to brush their kids' teeth. It's a big challenge because parents face this problem all the time. It's almost like war at home when brushing happens at night. This is just a small video by ADA.
Getting kids to brush their teeth for 2 minutes, 2 times a day can be a challenge. But teaching them to take care of their teeth can help instill a lifetime of healthy habits. It may help to encourage your child that toothbrushing is fun and helps fight the bad guys, like sticky plaque. There are a lot of videos, games, and apps online to make brushing more fun. Try letting your child pick out his own toothbrush and toothpaste. After all, there are a lot of child-sized toothbrushes with soft bristles in favorite colors and cartoon characters. And fluoride toothpaste come in a variety of flavors, colors, and some even have sparkles. Just look for toothbrushes and toothpaste with the ADA seal of acceptance to be sure that they do what they say. Start to brush your child's teeth as soon as they appear. For children younger than 3, use a child-sized toothbrush and just a small amount of fluoride toothpaste, about the size of a grain of rice. When your child is between the ages of 3 and 6, use a pea-size amount of toothpaste. To begin brushing, place the toothbrush at a 45-degree angle to his gums and gently move the brush back and forth in short, tooth-wide strokes. Brush the outer surfaces, the inner surfaces, and the chewing surfaces of the teeth. To clean the inside surfaces of the front teeth, tilt the brush vertically and make several up and down strokes. Once you are comfortable with letting him brush on his own, usually around the age of 6, supervise that he is using the right amount of toothpaste and spitting it out. To help keep your child focused while brushing, set a timer. Play a favorite song or video for 2 minutes. Make a reward chart and add a sticker for every time he brushes for 2 minutes, 2 times a day. Once brushing becomes a daily habit, it'll be much easier to get your child to brush. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
So that's just a little summary. Out of this, the critical point that I want to take back is the amount of toothpaste. Okay, we have to use a fluoridated toothpaste, but how much? So when the teeth initially come in, just a rice grain or chawal ke dana jitna, as seen here, for a child less than 2 to 6, about a matar ka dana or a pea size, and older about 1 centimeter, and older you can do an adult brush with about a regular, like how you put it. Whenever you put the toothpaste, make sure you push it right into the bristles, because so it doesn't fall out and the kids don't swallow it. What happens, you take the brush, by the time you reach the mouth, part of it is already fallen off, right? So make sure you press the toothpaste inside. These are some apps now. This is just a small video showing that I've actually tried this with my nephew, so that kind of motivates them to brush. So every time you move, the brush actually moves around that on the screen. It's got a little sensor in it. So this is what you guys can do at home. What can I do for you to help you as a pediatric dentist? Why should you come to me at that age 1 visit is what I'll go into next. We risk assess the child, how, depending on what they're eating, how much cavities they have, how many cavities the parents have, what kind of diet they're taking. We do something called a risk assessment, and then we can help you, give you a customized plan for them. Fluoride varnish is a cornerstone of prevention from a professional standpoint. We do it twice a year. APF gels also is applied like a form of fluoride, and pit and fissure sealants. I'll just touch on fluoride varnish and sealants, what they do. Of course, professional tooth cleaning and polishing every 6 months if required. So fluoride varnish, we use this a lot in children as a pediatric dentist. It's quick, safe, and effective way to reduce decay. It's recommended every 3 to 6 months and easy to apply. This is a kid that's getting a fluoride varnish application done in my practice. That's me giving it to them. So essentially, it's like a paint. We paint onto the teeth, and they can't eat or drink for half an hour later, but it reduces cavities by almost 40 to 50%. Done biannually, twice a year. Pin fissure sealants, they're essentially coatings that we put in the grooves of the teeth, in the chewing surfaces, so that you don't get cavities. So this is what a pin fissure sealant looks like. It's very helpful for young permanent teeth or young children. The young teeth that are at the back, they tend to get cavities very early. So this is another preventive thing that you can go to the dentist and ask for. Fluoride varnish and sealants. Two preventive ways to prevent cavities, because we don't want them to get to what I'm going to show you next. So cavities develop, up till now we were talking about those early cavities that start. They go deeper and deeper. So this is the nerve of the tooth. Once it reaches the nerve, we call it pulpitis. And once it gets worse, it goes to a region where it needs a root canal. Okay. And we do that every day for children. Unfortunately, as I told you, parents don't come in on time. They come in too late. And I get to see, I'll show you some pictures later, but what they found out, it leads to lower test scores. It leads to embarrassment when you have a swelling or black teeth. In kids today, can be really harsh on each other. Anxiety, pain, infection, poor academic performance, and even behavioral concerns as they grow. So it's quite alarming. So this is, what I get to see on a daily basis. Swellings, infected teeth, we don't want to get here. So that's what the idea of this whole talk is, to start early, come in early, do the preventive stuff that I'm telling you, so that we don't get to this point. Some of this requires general anesthesia and sedation, and very expensive and much more time consuming and painful for the child. So again, dental caries is a lifestyle disease. Plaque plus sugar create acid. Acid attacks the tooth and leads to decay. So it's a lifestyle. So coming to the top, what you guys are all doing, yes, and helping build good habits and spirituality. Yoga can play a good role in this. It can reduce the stress in kids and parents. It can improve focus and improve good habits. It can encourage calm and healthy routine. Yoga helps in focusing and a holistic approach to health. So, apart from the family doing yoga together and, getting this, so all of this entitled would eventually lead to a better routine. And when you're doing it together, brush together. Make it a fun thing after maybe some kind of meditation or yoga. Go into brushing together as parents. Encourage them, play a nice song, enjoy with your kids. And since we're talking about, positivity and change in the world, so I came across this. I'd gone to a hotel recently, and, I was very impressed. They had a bamboo brush, which is sustainable. And they even had chewing tablets rather than toothpaste, because of the water that gets wasted. You can just take these tablets and use them instead of, the conventional brushing with water. So I just thought I'll just share this, since we're talking on a topic like, spirituality, education, and, sustainability, and, in the world, going green. Yeah. So prevention is better than cure. So the 5 steps would be to brush, limit sugary snacks, visit your dentist at least twice a year, and floss, and change your toothbrush every 3 months. That's one of the tips. So I'll like to end with that. And take home message would be: healthy smiles lead to healthy futures, and prevention is key. So brush, floss, visit your dentist. Start small, think big, and build a lifetime of habits early.
मैं ज़मीं तो आसमां
These are some of my
और
patients.
अधूरी दास्तां नाते कैसे जुड़े तू रेशम सी परी मुझ में क्या है सादगी रास्ते मुड़े हुए हम तुम अलग है फर्क है फर्क है फर्क है हर
So that's my email ID. Anybody who needs to contact me there. And that's a QR code you can scan. So you'll get my entire details, all the clinics I consult and visit, and lots more about my education and all of that. So thank you so much for this great opportunity. I hope I could do justice.
Thank you so much, Nikhil sir, for your insightful and informative talk. We really appreciate your expertise and the valuable knowledge that you have shared today, especially in helping families to take proactive steps, so that they can ensure good oral health for the children.
Thank you
Thanks
so
a lot.
much.
Let's check with the participants if they have any questions or anything they want to share with us.
Sure.
Participants, if you have any messages, you can drop them in the chat box. I can read it out, or simply unmute yourself and speak up.
Good evening, Dr. Nikhil. Thank you for the lovely talk. Just a query, that is the usage of Dant Manjan, that we prepare
Right.
at is as good as a toothpaste, because there are so many things around that what all the toothpaste carries, and it
Absolutely.
also.
Thing with Dant Manjan, it's actually highly abrasive, so it actually leads to more problems because it's not controlled. Like a toothbrush is actually made with certain specifications all over the world, and we recommend a soft toothbrush. So that manjan cannot be, the tree, whatever the thing. It actually causes more abrasion and problems later. So toothpaste, it's a regulated toothpaste for children. It's all approved, and it doesn't really cause any kind of, it's been there, as far as you don't ingest and swallow it, it's okay. In fact, all these other Ayurvedic pastes and all are questionable, but the standard toothpaste from a standard company is usually the ingredients are time tested and they're safe. Even there's a lot of concern about fluoride and how it's bad for the teeth and all that, but because since it stopped, it's caused a lot of increase in cavities. So the trade-off between whether it's the benefits versus its harmful effects of giving it, the benefits outweigh way more. That's why the quantity is very
So
important.
toothpaste is better. Yeah?
Any day. Yeah.
Toothpaste is better. Yeah?
Toothpaste is better. Yeah.
Thank you.
You're welcome.
Thank you, Nikhil sir. Dr. Bijlani sir, I request you to share your thoughts, please.
Thank you, Dr. Nikhil Grover, for a very short and sweet presentation and giving a lot of useful messages, particularly about the very young children, when we feel that the child is too young to understand anything about dental hygiene, and maybe it's only baby teeth, and therefore it will not matter even if they don't stay healthy. The child will have a second chance when the child gets permanent teeth. That is a very common impression. Maybe you may like to even elaborate a little more on how neglecting the baby teeth can later on affect the permanent teeth that will come. What all difficulties could be there, and because it is certainly a challenge to observe good dental hygiene with very young children, particularly infants and children below 2.
Yeah. So actually, we try to prevent. The whole aim was to prevent them from getting to us, getting those deep cavities. But it does happen. It happens all the time. And what tends to happen is if you remove the PBT too, sometimes we can't do root canals. We can't save them. If we do remove them, what tends to happen is the entire mouth gets the teeth behind start shifting to those places, which leads to the teeth being are not straight. They get irregular because of the fact that space gets taken up. That leads to one problem. Then they can cause infections and cause damage to the permanent tooth bud below, as well as lead to the cavities in the children's teeth can spread to the permanent teeth. So that's why we want to avoid all of that. And most of the kids really small today, we do on average. Most of my cases, in the difficult cases, we do under nitrous oxide sedation, because so most of those children are not managed. They cannot manage with the air rotor and all of that, chair side. So we have some of them might need general anesthesia. So we have to take them into the OT and treat them there. So as far as I know, you should stop them as early as possible, rather than waiting for it to get so deep. And it does cause a lot of damage to the permanent teeth also, because it can lead to cavities on those teeth.
Long back, there used to be a substance called boroglycerin, I think, which was rubbed with the finger. What's the status of that these days? How's the current?
Boroglycerin it's just a soothing thing for ulcers or something. It doesn't really help with cavities. The only known material is fluoride, and now we have something called CPP ACP, which is a modification of that with casein proteins, which actually helps reducing cavities. Those are the only two documented evidence-based caries preventive methods. Is fluoride either as a toothpaste or as given as a mouth rinse, or then applied by us in the clinic. Fluoride vanishes at its own, or we do have something called tooth mousse, GC tooth mousse, which children can apply for cavity control. Those are the only known methods. And obviously dietary control and regular visits to the dentist so you can keep them clean, your teeth.
How about those parts of the country where fluorosis is quite common?
See, fluorosis is a different reason. Fluorosis happens because when the teeth is developing. So having high fluoride will definitely prevent you from cavities if you're still in that area. But once it's occurred, you cannot reverse that process. So the fluoride, there's no contradiction to using a fluoridated toothpaste as long as you're using it correctly. And if you have a high fluoridated area, you should reduce the fluoride in the water by various, which they do in most of those, especially in South India and parts of it where, the fluoride levels are very high. So you can control the fluoride levels. But there's no contraindication to brushing with fluoridated toothpaste in those areas. Because the idea is high, there's low dose fluoride that should be in the environment all the time to create, that reaction, the pH balance that has to be maintained. So it doesn't let the calcium get leached away from the tooth. So it should be in the solution all around in the saliva always. But definitely fluoride levels at the optimum level do help reduce cavities. But the RO water that we're taking nowadays in most of our cities actually filters all the fluoride away, or any other mineral for that matter. So the reverse osmosis water, so that actually is causing increase in cavities indirectly. So that's why we need to add that extra fluoride. And apart from just the fluoride in the toothpaste, the brushing action, the cleansing action of the floor and of the toothpaste also helps keep the cavities, everything clean. So that brushing action removes the plaque and the bacteria, which eventually cause the acid and the cavities.
Continuing that question about the tooth powder, there are Ayurvedic tooth powders which it is recommended should be used with oil, mustard oil or sesame oil. So
Right.
if you're using oil, then the abrasive action will probably not be there because of the friction will be very little between the teeth and that. One of the advantages is that even if the child swallows a bit of that, it doesn't do any harm, unlike the toothpastes. So, what would you what would be your
Then you
opinion
might
on
as well
that?
not use anything. Just use a plain brush, because then you're just doing a cleansing action. It has no additional benefit. For children, why would you recommend anything like that? We don't have no guarantee what the oil would have, or any of the the contents of that powder are also questionable. At least that industry is not that as well regulated as most of the toothpaste and all that are come by the company. They're all tested all the time regularly. We've already seen horror stories about the rest of the or Ayurveda products that have been launched, and what all goes into them and how it is, because it's not a very well regulated industry.
Yes, but I mean, there
is no evidence.
yeah,
I go purely by evidence. There is no evidence for those being effective at all. So there is no evidence-based guideline in the world that tells you to replace toothpaste with a powder, because there's no studies on that. If there is no evidence, it does not exist. There have to be better randomized control trials or some kind of evidence to back that. There's enough evidence to back toothpastes and the way they work. For these, there is no evidence. It's just hearsay.
Well, I mean, that shows is a perpetual debate.
Yeah.
There's a lady, I don't know whether you heard of that, Bhaswati Bhattacharya.
Yeah.
You heard of her? She studied modern medicine in the US and then came and did a PhD in Ayurveda at BHU in Banaras.
Right.
And she has written a few books. In one of them, she says, I think it's Everyday Ayurveda. What she says is that as a teenager, when she migrated to the US, and
Right.
she cited an anecdote that at home she was in the habit of rinsing her mouth after every meal. That's a common
Right.
thing in India. And it makes sense
Right.
because you will have something, some of the food left behind in the mouth.
Absolutely.
So no matter what one has eaten, if one rinses the mouth, that will be washed out and therefore it will not be fermented, will not form acid. So that was a habit that she had developed. When she went to the US and after lunch, she started going to the washroom to rinse her mouth. She was told two things. One, how can you put that dirty water in your mouth? They thought water in the washroom is always dirty. You have to put in the mouth only properly clean water, which is fit for drinking. How can you put that? Second thing, to spit in the washroom is rude. So these are two comments which her classmates made.
Right.
And cultural differences. So she thought live in Rome as Romans do. So she stopped doing that. And she developed cavities after that. She never had any cavities before that.
Right.
So just this habit of rinsing the mouth after every meal, rather after eating anything at all. Because
Right,
very
absolutely.
very often snacks like say a chocolate or chips, they are more harmful, as you said.
Absolutely.
a normal meal, which may have
Right, sir.
fruits and vegetables.
Right, sir.
So, no matter what one has eaten, if one cultivates that habit right from childhood, probably that should go a long way of just rinsing the mouth with water.
Great tip, sir. I tell that to my parents, all the patients, all the time, to rinse their mouth after. If they can't do anything, at least rinse their mouth, because that's a great Indian tradition. Most of our habits in India are rooted in a lot of logic. As far as the thing there, if there are more studies, I mean, what you were saying about tooth powder and all, I don't believe it because of the abrasive content. But with the oil, then it nullifies any kind of action. So then it's just, that's why I was a little about that. But I'm sure if there's more studies and evidence on it, it'll be a great option if whatever works. As far as we can reduce the the burden of cavities in children, what rinsing is a great habit. In fact, the mothers who have milk at night, uh, where they breastfeed and they choose to and they can't stop with the child, I always tell them keep some water next door. If nothing else, just make them drink that 2-3 sips of water or 4 sips of water, so the milk also gets washed away at night when they're lying down. So if you can't stop completely, at least do that water washing.
Yes, I think that was again a great tip for very young children, that we should not use the bottle as a comforter.
Absolutely, sir.
Better to use a blanket or a toy rather than a bottle.
Absolutely.
Because even if the bottle has water, if the child keeps it in for very long, probably it can lead to some deformities, no, in the teeth or in the
dental
mouth.
Yeah, it causes the arch to expand, not develop properly, and lead to airway issues and all later.
Well, thank you for making it so interesting and answering all these questions.
Thank you so much, sir, for giving me this opportunity, sir.
I'm just reminded of a book that I read long back. It was a book on electronics
Right, sir.
for the layperson, the general public. So I picked it up, and in the preface, one of the first few sentences were that I do not promise reading this book will be a pleasure, but I can guarantee it will be painless. And then he said that that is as much of a guarantee as any dentist can give you. Not be a pleasure, but it will be definitely painless. But I think the way you have shown the videos today, you can make the child's visit to the dentist a pleasure.
That's what we try to do, sir. So we have a lot of there's the skills you develop over time, as pediatric dentists. When I started, nobody even knew such a thing exists, and we still are trying to get it out there that if the habits are formed young, early, good, we won't have a problem to land up treating decay when they're older.
Actually, dentist is the most dreaded doctor.
I know, but that's what we're trying to do now. Trying to make it easier. So when they come, first visit is more fun. I have like toys, you have a play area. I've learned magic and balloon molding and all that just to keep them happy.
And probably when it comes to children, when it comes to adults, it's the same for adults. If adults
Exactly, they're equally fearful. But actually, the habit is that subjective fear has been put since childhood, so it continues. So if you have a good experience as a child, you would never be scared when you're older.
True.
So everything starts there. That's why the youth is our future. So that's why
all conditioning, mental conditioning in early life.
Absolutely, sir.
Thank you, any more questions or anything in the chat or anyone else's?
No, not so far, sir. So yeah, I'll just quickly inform before closing the session that today's session's recording and all Yes Talks recordings are published on our YouTube channel, Yes Spirituality. Please do visit the channel and explore extensive content on yoga, education, spirituality, and related subjects like psychology and wellness. Nikhil sir, thank you so much once again for sparing.
Thank you so much for this opportunity. Thank you so much.
We'll close today's session with a moment of peaceful silence. Namaste.